which was efficient and which was not, and then subsequently put together a study combining the efficient ones, and we decided to opt for a different approach. We included in our pool, in our cocktail, we included all the treatments that could be potentially effective for oxidative stress and cachexia to see if that were effective. And if everything was effective, we would then select in a phase 3 style randomized trial, we would then single out the most effective of them. So our cocktail included a diet with a high content of polyphenols from food sources, a glass and a half of wine, generally is all that's needed, but polyphenols can also be taken as in tablet form as supplements. Pharmaconutritional support enriched with EPA and DHA. I'm not going to go into the details. This was felt to be an effective treatment for cachexia because it's able to induce a reduction in cytokines, etc. And then later that was reconsidered, and today we're a little skeptical as to whether this treatment can be significant. Obviously, we also included EPA, the only treatment with therapeutic indications according to Pharmacopoeia for cachexia. We had to include it. And we also included antioxidant treatment with alpha-lipoic acid, carbocysteine lysine, vitamin E, vitamin A, vitamin C, and a COX-2 inhibitor as well. Now, obviously, I'm not going to go into too much detail. Cyclooxygenase is certainly involved not only in tumor progression, but also in neoplastic cachexia. And an inhibition of COX-2 could, in fact, also be effective. Should I close? I have a couple of minutes. Okay, the treatment lasted 4 months, as I said before, 6 weeks. There were 39 patients enrolled, and most of them were overtly cachectic. A certain number had a slightly lower mass index than normal, body mass index. The others had all lost weight. The performance status was generally quite good, between 0 and 1. After 4 months, we noted an improvement, an increase not only in weight, but also an increase in lean mass, which was very important because oftentimes the so-called success of treatments against cachexia stop at an increase in body weight. And that is not certainly enough for the body. What we need is an increase in muscle mass, lean mass. And after 2 months, all the weight increase was due to the increase in lean mass. And the dry mass, lean mass was also measured. It's not a direct measurement, but it's an evaluation. We saw, to our surprise, that you can see the levels of pro-inflammatory cytokines and leptin, and there was an improvement in the quality of life factors, particularly the level of appetite, and a questionnaire was given. It was considered to be important by oncologists, the ORTC, Quality of Life Questionnaire, and also the fatigue questionnaire. So a reduction in that means an improvement in the patient's weakness, so less weakness in the patient was noted. In the patients. We then conducted a multivariate analysis to see what the increase in LBM in lean body mass was due to, which of the variables was responsible. And we saw that the only variable, independent variable of all of them that was looked at was the IL-6. IL-6 tends to dictate all the rest. A reduction in IL-6 is what independently shifts all the other parameters. And I've just about finished. At the end of the study, out of 39 patients, 22 proved to be responders. The limit was expected to be 21 responders. And this led us to conduct another study that I'm not going to comment on today here, but has already been finished and published in last month's Oncologist. We assigned patients to 5 arms, taking 5 treatments against cachexia to assess which was the most effective. And that's it. Thank you very much.